Mr. Benson appears to be suffering from an acute myocardial infarction, and his decision to refuse further treatment and transport against advice could be considered an ethical issue for paramedics. According to the Australian Law Reform Commission, all competent adults can consent to and refuse medical treatment provided they have sufficient decision-making capacity and are aware of the risks. Given Mr. Benson's condition, it is likely that leaving him at home will cause his condition to deteriorate, possibly resulting in a death that could have been prevented. Mr. Benson's signs and symptoms coincide with that of an acute myocardial infarction. He allowed John, the paramedic, to administer oxygen and sublingual nitrites with good effect. However, Mr. Benson still does not want to be transported to hospital despite the diagnosis and recommendations of the paramedics. He has provided paramedics with an advanced health directive that states he does not wish to receive any life-sustaining measures. However, his daughter, Jenny, states she is his health attorney and demands the paramedics transport Mr. Benson to hospital. Mr. Benson's wishes reflect the bioethical principle of autonomy that a patient has the right to accept or decline medical treatment, taking into account their personal circumstances, beliefs, and priorities. Whether it is ethical to leave him at home is questionable in relation to non-maleficence and beneficence. Administering GTN while contraindicated may be seen to be negligent practice, as its administration does not benefit Mr. Benson and places him at further risk of deterioration. It could be argued that leaving Mr. Benson at home and treating him with GTN while contraindicated goes directly against the bioethical principles of non-maleficence and beneficence. In line with the principle of justice, Mr. Benson still has the right to the same treatment as any other patient. However, considering he has provided a valid refusal, it is not unethical for John to withhold treatment. The Paramedics Australasia Code of Conduct consists of integrity, respect, responsibility and accountability, competence, consent for patient care, confidentiality, research and ethical review. When considering Mr. Benson's case, the attending paramedics did not act with competence or responsibility by giving him a dose of GTN, as his hypotension meant he was not indicated for its use. The use of this drug in Mr. Benson's circumstance could have in fact led him to become incapacitated or unable to think clearly for himself, and in that instance he would be relying on his advanced health directive to outline his wishes for treatment to be withheld. Even though the paramedics gained his consent for the administration of this drug, they did not inform him of the risks of administering it to a hypotensive patient. Therefore, they did not allow Mr. Benson to provide informed consent. If Mr. Benson were to become incapacitated due to the administration of GTN, his health attorney, Jenny, is legally allowed to decide the treatment plan, and Mr. Benson may be transported to hospital against his wishes. Another alternative course of action is that Jenny may stay with Mr. Benson, and if he deteriorates, she can either call another ambulance or take Mr. Benson to hospital herself. Considering Mr. Benson's recent loss of his wife, it is reasonable to assume that he may be suffering from a degree of depression at this time, which could in turn be clouding his ability to make sound judgment. At this time, if the attending paramedics feel that this is the primary reason for Mr. Benson's refusal of transport, they may be within their right to persuade him to come with them to hospital. This kind of patient persuasion is only appropriate in situations where the paramedics believe that once the patient is of sound mind, that they may change their decision regarding refusal of treatment. There are 3 elements of a valid refusal that need to be apparent to allow a patient to refuse treatment or transport. If the patient made the decision to refuse voluntarily, the decision relates to the current circumstances and the patient has the capacity to refuse. This is then classified as a valid refusal. According to the Queensland Powers of Attorney Act, Mr. Benson has sufficient decision-making capacity and is therefore well within his rights to refuse treatment for himself. Capacity is determined for a patient if they are capable of understanding the nature and effect of the decisions they are making, being able to freely make decisions about the situation, and being able to effectively communicate their decisions. He has provided a valid refusal by meeting the VERCA criteria of voluntary, informed, relevant, capacity and advice. He has been properly assessed, given the recommended healthcare advice, including the risks associated with refusal, and he has clearly communicated his decision. In regards to Jenny's demands, a statutory health attorney may only make decisions on behalf of an individual if one's capacity to make decisions about their own healthcare is temporarily or permanently impaired. Examples of temporary incapacitation include unconsciousness or delirium, and permanent incapacitation may include dementia, acquired brain injury, or intellectual disability. A health attorney can only make these decisions when capacity is lost and in circumstances where an individual has not drawn up an advanced health directive, an enduring power of attorney has not been appointed by the patient, and a guardian has not been appointed by an administrative tribunal. As far as the paramedics can tell, Mr. Benson maintains his capacity. He is able to understand the implications of his choice as explained to him by the paramedics and maintains the right and wish to refuse treatment as supported by his advanced health directive and as reported by Mr. Benson himself. Queensland's statutory regime provides a hierarchy of people to make decisions on behalf of an adult patient who lacks capacity. Where medical officers don't agree with the demands of the family for a patient who lacks capacity, the Consent Processes within the Powers of Attorney Act 1998 and Guardianship and Administration Act 2000 can be used to override their decisions. Mr. Benson's Advanced Health Directive is a legal document allowing him to specify that he does not wish to have any life-sustaining measures implemented should his condition deteriorate. In the pre-hospital environment, paramedics must abide by this, despite what they believe may be unethical or a family member's request, as this document takes legal precedence. As Mr. Benson maintains capacity, he is within reason to determine the course of his own treatment. He has provided a valid refusal by meeting all of the VRCA criteria, including acknowledging potential risks and outcomes of remaining at home without further treatment in hospital. By leaving Mr. Benson at home against his daughter's wishes, paramedics are respecting Mr. Benson's autonomy after having provided enough information to allow Mr. Benson with full understanding of the potential risk to refuse treatment as it is his right. The decision to withhold further treatment and transport to hospital for Mr. Benson was made ethically and justified appropriately by the attending paramedics.